Welcome to the Business Talk podcast. Today we are thrilled to welcome Dr. Hitesh Chavda, one of Ahmedabad, Gujarat leading surgical gastroenterologist and liver surgeons. Dr. Hitesh Chavda brings over 24 years of experience in the field of gastrointestinal surgery. Known for his enthusiasm, energy, and exceptional surgical skills, he has earned a reputation for his expert knowledge and healing hands. Dr. Chavda graduated from the medical faculty of the University of Gujarat in 1993 and went on to complete his residency training at the same institution. In 1997, he obtained his Master of Surgery degree with honors. His advanced training took place at the Department of Surgery at Civil Hospital and BJ Medical College, Ahmedabad. He subsequently completed his advanced surgical training and obtained his fellowship of the Royal College of Surgeons from the Royal College of Surgeons of Edinburgh, UK in 1999. In this episode, Dr. Hitesh Chavda will share his expertise on the topic innovations in hepatobiliary surgery, cutting edge techniques for cancer treatment. Dr. Chavda, we are truly honored and delighted to have you on the podcast.
Thank you, Mr. Dipak, for having me here at this platform. Thank you so much.
Yeah. Dr. Chavda, what are the most significant advancement in hepatobiliary surgery for cancer treatment that you have seen in recent years?
So let me explain. Hepatobiliary surgery means surgery which is done for liver, pancreas, and biliary tree. So, in last 2 to 3 decades, there has been a huge development in this field in terms of imaging techniques, expertise, so many things. But the most important thing that has happened is the minimally invasive surgery, that is laparoscopic surgery and robotic surgery. So conventionally, the operations for, say, liver cancer or a pancreatic cancer is done with an open surgery. That's still a standard one. But in selected number of patients, these operations can be done with laparoscopy or robotic surgery. That is a keyhole surgery. So that's the important advancement. Another thing is that these operations are usually major operations. So the development in the anesthesia, it is very crucial because this patient has to fully anesthetize for so long. So the technique of anesthesia has drastically improved. And the third thing is the imaging, the preoperative imaging, the diagnosis of the cancer at an early stage, that has made this outcome of these tumors quite significantly impacted. So this is very important. And the last thing is the advancement in the pre-operative as well as the post-operative treatment. So majority of the patient used to come in an advanced stage. So to downstage them, to make them operable, and to achieve a cure, which used to be a challenge, is now becoming a reality. So there has been a huge development in this field, Mr. Dipak.
Insightful. Dr. Chavda, could you explain how robotic assisted surgeries are transforming in the field of hepatobiliary surgery, particularly in treating cancer?
So, as I said, robotic surgery and laparoscopic surgery are almost similar. The basic concept is the access. So the liver and the biliary tree and pancreas is situated in the upper part of the abdomen. So to access these organs, we need large incisions. So the trauma of access is too much, for certain type of cancers. So robotic surgery is a precision surgery, and the access to that organ becomes easy with small keyhole, and the overall recovery is very fast. The hospitalization is less, the requirement of painkiller medication is less, and there is a faster recovery after the surgery and faster return to the normal, activity. So this is a huge advancement. So for even liver cancers, pancreatic cancers, and certain biliary cancers, robotic surgery is coming up in a big way, including transplant. So many centers across the world are now performing these operations robotically. So I think robotics is a future.
Yeah, okay. How does precision medicine play a crucial role in personalizing treatment plan for patients with hepatobiliary cancers?
So precision medicine means it's a personalized medicine. So let me explain. So all cancers are different. Bile duct cancer, pancreatic cancer, and even liver cancer. Liver cancer is also, very diverse form of tumors. We get primary liver cancers, we get secondary liver cancer, which spreads from other part of the body. All the patients will behave differently. So what oncologists nowadays perform is genetic or molecular profiling of these patients. So the biopsy material which is taken is analyzed in detail on the genetic aspect, and the treatment is tailor made for that particular patient. This is called a precision medicine. So we come to know that for this particular patient, for this particular cancer, this is the best modality of treatment. And this test that is called NGSPN and other sort of genetic or molecular profiling will also guide the oncology team to decide the response of the treatment and to help follow up this patient. So rather than wasting time, a particular effective precision medicine is given to this patient either pre-operatively to downstage or as a post-operative care to improve the outcome. So this is called precision medicine. And also, nowadays what they perform is a liquid biopsy. It's very easy. Liquid biopsy is a test which is done on the blood test and other samples. So they find out circulating DNA of the tumor cells, which is, very important to know the modality of treatment that they can offer, the follow up this patient, response to treatment. So all this has become very, very, fine tuned with this all advancement. So they decide whether this patient needs a targeted therapy or an immunotherapy or a marker guided therapy. All that can be tailor made to that particular patient for that particular cancer. So this helps to get the fantastic outcome. It's a personalized, treatment for that particular patient.
Dr. Chavda, can you share any novel surgical approaches being implemented for hepatobiliary cancer treatment that are showing promising results?
Uh, so being a liver surgeon, I'll talk about liver. So, uh, as I said, the recent advancement is laparoscopic surgery and robotic surgery. Now, liver is a huge organ. It is situated in the upper part of the abdomen and it's very versatile. It's the largest organ. Now, liver has a tremendous capacity to regenerate. That's how the live donor transplant was developed, and we could operate larger cancers with a good outcome because liver regenerates in 2 to 3 months. So this is very important. So we do get many cases which are, originally inoperable, large tumor inoperable. So last couple of decades, it was realized that liver volume can be manipulated. This is a very interesting concept. So what we call is a volume of the liver which remains behind. So for example, liver is 1 kg. We can remove about 700 grams of liver from 1 kg liver. The remaining 300 grams of liver will regenerate. In general, is a layman term. So in a healthy liver, not in a diseased liver. So there are various techniques which are used by the team to increase the liver size before surgery. This is a very interesting, it's called volume manipulation. So there are techniques called portal vein embolization and ALPS and all that. So we do certain procedures pre-operatively so that the tumor becomes smaller and the remaining liver becomes bigger. And then we remove the tumor and the remaining liver is fine and these patients have good outcome. So in portal vein embolization technique, we embolize one vein on one side that blocks the blood supply. The remaining liver over the period of 1 or 2 months increases in size, and then we go and remove the tumor. The other concept is ALPS, that is associating liver partition with portal vein ligation technique, where we do the surgery in the gap of 10 10 days or 12 days, it's a two-stage surgery. We go inside, we ligate certain pedicles, we divide the liver, close it, and go out inside again after 10, 12 days. And there is a huge, hypertrophy or growth of the liver in a very short span of time. This technique is evolving. So what I'm trying to say is that all this has made surgery, possible, because in cancer of this system, surgery is the best cure. So if we offer surgery and remove the tumor, they have a better survival. I mean, they also need chemo and other things, but these patients can become operable with all these techniques. So this is coming up in a very, very big way. The other thing is downstaging of cancer. So now the imaging has become powerful. We know the amount of tumor spread, everything, and there are various techniques to preoperatively, these patients can be given for a couple of weeks or certain period of time. The tumor can be downsized or can be made shrunken and can be operated. So this has become possible. So we never used to do this in the past. So this is extremely exciting. And all this has, and also the artificial intelligence. See, there are various sophisticated machines available which uses artificial intelligence even in laparoscopic and robotic surgery. So intraoperative ultrasound, all this has made surgery safe and more aggressive way of treating hepatobiliary cancers.
Uh, Dr. Chavda, what challenges do surgeons face when integrating these cutting-edge techniques into traditional surgical practices?
Uh, See, all these machines are expensive. So uh, to use these machines, hospital has to have those machines. That's a big investment. This is one thing. Second thing is you have to accept the change and get yourself trained. So training becomes an important part because there is a learning curve for everything, from conventional open surgery to laparoscopy and robotics. So that learning curve you have to pass through. So for surgeons of my generation and the younger surgeons, they all have to get trained for this thing. The other important thing is the cost of the operation. So as you use all these expensive instruments, the cost will increase. So we have to balance whether using this is beneficial, with this much cost. So that has to be balanced for that particular patient. The third thing is insurance, because we get a lot of patients who have insurance. So insurance companies, they have a tie-up with the hospital for particular procedure, for particular techniques. So not all the procedures, you get the approval to perform robotically because it will increase the expense. But now this scenario is changing. Many private companies are accepting it, and patients are getting benefit of this procedure. So these are the challenges, but I think in couple of years we'll overcome this, and this will become a routine practice in our specialty.
Dr. Chavda, how do these advancements impact recovery times and overall patient prognosis in cases of liver and biliary cancers?
So as I said, uh, hepatobiliary cancers usually uh, are diagnosed in an advanced stage still. So uh, to have a sophisticated uh, instruments and protocols, make them early diagnosis of this patient. If you diagnose them early, the outcome is better. So an early diagnosis is very, very important. And secondly, to stage the disease preoperatively with all this imaging helps us selecting patient to go for either upfront surgery or downsize, then operate, and then offer certain type of treatment. So, and third thing is the compliance of the patient, the acceptance of the procedures or certain procedure or certain therapy. Uh, so a proper explanation with the multidisciplinary team And tailor-made therapy, if it is offered at the right time in the particular patient, will definitely improve the overall survival in such patients.
Are there any innovations in imaging or pre-operative planning that have improved outcomes for patients undergoing hepatobiliary surgery?
Yes, so this is important. So initially, when we were resident, we used to do only ultrasound. There were no sophisticated CT scan or MRI machine. But now you can see there is a huge development. That's what I was saying. Pre-operative imaging, uh, normal ultrasound, it's useful for screening. Second thing is a CT scan and MRI. So these machines are very, very sophisticated, and an accurate diagnosis can be made pre-operatively with this sophisticated machine. And on top of that, development of nuclear medicine. So a PET scan and that sort of scans will identify a particular type of cancers in a very early stage. That will help us to stage the disease, to check for response in the therapy. So this has made surgery very, very safe, you know. And other thing is there are certain techniques. For example, when we perform major liver surgery, we use intraoperative ultrasound. Intraoperative ultrasound means we perform sonography of the liver in an open abdomen, and also that can be performed with robotic surgery as well as laparoscopy. There are drop-in probes. You just put a probe inside with a wire, and you can do an ultrasound of that particular organ. For example, liver. You find out where is that small tumor located. Then you can reach there and resect it. So, and you can compare real time on the screen with that machine. So all this sophisticated imaging is possible now to identify, particular cancer, the location, and to find out new cancers on table at the time of surgery. There is contrast enhanced ultrasound. That is, you give some contrast, and the tumor will light up at the time of surgery or preoperatively, and you pick up, mark that tumor. So all this has become very, very sophisticated nowadays, and this makes the aggressive surgery possible, and that improves the outcome in such patients. So the imaging is very, very crucial, and there is a huge advancement.
How is collaboration between surgical teams and other specialties such as oncology and radiology influencing these innovations?
So, see, uh, when we see any patient who has hepatobiliary cancer, for example, liver cancer, so this patient is managed by a team of doctors. That includes a surgeon, who's a liver surgeon, a radiologist, an oncologist, an interventional radiologist, a nutritionist, a counselor. So all these team members see that patient, decide what is the best modality of treatment. So there are various treatments. For example, local regional treatment, uh, chemotherapy can be given directly into the liver cancer, or with a probe, the tumor can be burned, surgically resected, or patient may have an option of liver transplant or a preoperative chemotherapy and postoperative chemotherapy. So all this decision has to be taken by a team, that is a multidisciplinary team, preoperatively. And then a tailor-made treatment is decided for the patient, and this patient is then carry on, with that type of treatment and followed up with the same team. And if there is any change in the plan, can be tailor-made at that particular time. So a collaboration with all these team member is very, very important when we deal such with this type of patient, because the team member should offer you what is the best treatment rather than just pushing a particular treatment. So this is important. This is almost practiced in most of the advanced unit nowadays across the world. So that's called MDT or multidisciplinary team approach for these cancers.
Dr. Chavda, could you share some of the examples and experiences of your patients during in OT and out OT uh, procedure?
Uh, there are many examples. We do face very challenging patients many a times. We recently performed one child. who was 10 years old. He had a huge tumor, this big tumor in the liver. And we admitted him and we worked up him for tumor, and we found that his pumping is only 20%. His heart was not well. And so we were stuck. Uh, the cardiologists were involved, uh, and he did not have time. The tumor was, it's a huge tumor. I mean, everybody will think whether it is operable or not. Fortunately, in a couple of weeks, his heart function improved, and we decided the date for the surgery. On the previous day, he developed pain, and the tumor ruptured. So he presented with blood in the abdomen. His pumping was improving, and the surgery itself was extremely supra major. We admitted, we did an angioembolization. So angioembolization means you just put a catheter inside the artery and block the blood supply of that particular tumor to make sure that there is no bleeding at the time of surgery. And we prepared him. We discussed with the relatives, and it's a young boy. The next day, we operated him. Surgery lasted for about 12 hours. It's a huge tumor, extremely challenging surgically. We were not sure whether we will be able to operate or not, but we gradually performed the surgery. And with all prayers by us and the relatives, we could operate him. He survived, and it was unusual malignancy. He went home at 10 days. He also received chemotherapy, and he comes in my office to meet me, and his scan and everything is normal. His heart pumping is normal. So you feel so good when I think retrogradely how I could operate this. I mean, if I see a scan now, you get scared. So we do find such cases where it is a huge challenge, particularly the larger cancers and location and all this. This makes surgery extremely challenging. So you need a good team to support you at the time of surgery. Your anesthesia team, who should be an excellent one to maintain, hemodynamics at the time of surgery. Your assistant, your nursing staff, your theater, your blood bank, your pathology, and everything. So you need an excellent setup to perform this. So we do find such challenges when we accept such cases. So it's always exciting.
Dr. Chavda, does this age factor consider when you operate surgery?
And I don't think so. We have done a major liver cancer surgery in a 5 days old baby as well. So baby was diagnosed preoperatively that there is something in the liver. So after delivery, uh, we again, did a scan and everything, and then we took up the case and performed. We removed half of the liver in a baby who was only 5 days old. So there is no age limit. The only thing is these the younger patients are very fragile. So you need a proper, anesthesia team, equipments to perform this, and also post-operative monitoring. At the same time, older patients, So nowadays, we accept older generation patient also. I mean, who is 80 plus. So if they are physiologically okay, if the performance status is good, they have a willingness to survive. The social background is also important. The family has to support them. So all this, if it is done, the homework is done properly, and if we feel that yes, it can be done, then we do offer them major surgery, and they usually make it. So that selection is very important, and the pre-operative planning should be perfect to get the good outcome in this patient.
Yeah. Dr. Chavda, my last question. For patients facing hepatobiliary surgery for cancer, what should they know about the benefits and potential risk of these advanced surgical techniques?
So most of the patients they Google nowadays, so they have a set of questions when they come to you. When they come to you, they know whether this doctor is right for you or not. So they, Google everything and then come. So it's our duty to explain them what is the right procedure for you, and whether an open procedure is better or a minimally invasive or robotic or this is better. So as a surgeon, it's our duty to explain them that for this particular cancer, this is the best option. Second thing is, it is important to understand for cancer that usually hepatobiliary cancer, not only surgery helps. These patients usually need some sort of preoperative and postoperative chemotherapy or some systemic type of treatment. So it's a combination of surgery as well as systemic treatment. So this has to be properly explained preoperatively to the family and the patient so that they have a made up mind that yes, I have to do this, and then follow up on a regular basis to find out if there is any recurrence or not. So this concept is very important. So they should know preoperatively that what they are going to face. So this is very important nowadays because they just Google and then come with a fixed set of questions. So we normally sit with them, we explain everything, and then take a call.
Excellent. As we wrap up this insightful episode, we want to extend our heartfelt thanks to Dr. Hitesh Chavda for sharing his expertise on innovations in hepatobiliary surgery, cutting-edge techniques for cancer treatment. His knowledge and insights into the latest advancement in the field have provided us with a deeper understanding of how these groundbreaking techniques are improving patient outcomes. We hope our listeners gained valuable perspectives on the future of hepatobiliary cancer treatment. Thank you for tuning in, and we look forward to having us on the next episode. Thank you so much, Dr. Hitesh Chavda, for joining with us today.
Thank you.